Walk into a closed-up shed, an undisturbed attic, or an abandoned cabin, and you're likely stepping into a thriving biological habitat. These dark, quiet, poorly ventilated spaces provide perfect shelter for wild rodents. In North America, the most common resident of these spaces is the deer mouse. This species serves as the primary reservoir for sin nombre virus, a highly lethal strain of hantavirus. Yet the deer mouse experiences no symptoms. It carries the virus throughout its life without ever getting sick. While the mouse goes about its routine, it acts as a continuous biological dispenser. The virus replicates inside the rodent and is constantly shed into the environment through its urine, feces, and saliva. Because the pathogen is entirely harmless to its host, an active mouse population can spend months quietly coating the floors, shelves, and nesting areas of a building with contaminated waste, layering an invisible biological minefield into the surrounding dust. As long as that waste sits undisturbed, the risk to humans is relatively low. The danger emerges when the droppings and urine dry out, leaving behind brittle, virus-laden particles waiting for physical kinetic energy. That energy usually comes from us. Walking heavily across a contaminated floor, pulling old boxes off a shelf, or vigorously sweeping a dusty garage supplies the exact mechanical force needed to agitate the dried waste. When disturbed, these brittle particles break apart and scatter into the air. This process, known as aerosolization, creates a swirling cloud of microscopic dust, allowing the virus to be easily inhaled deep into the human respiratory tract. People often contract hantavirus while attempting to make a space safer. The sheer act of dry sweeping or vacuuming an old cabin is exactly what launches the pathogen from the floorboards and into the lungs. This timeline illustrates the deceptive nature of the incubation period. Once inhaled, the virus quietly replicates inside the human body for anywhere from 1 to 8 weeks. During this entire window, the patient experiences absolutely zero signs of infection. When the silence breaks, it happens abruptly. The patient enters the prodromal phase, suddenly developing a high fever, extreme fatigue, and severe muscle aches, particularly in the large muscle groups of the back and thighs. Because these early signs perfectly mimic a routine case of the flu, the patient rarely suspects they are in severe danger. They rest, take over-the-counter medication, and assume the bug will pass, delaying critical emergency medical care. But while the patient believes they are fighting a common winter illness, the virus has already secured its position in the respiratory system. It is simply waiting for the body's own defenses to notice it. The virus specifically targets endothelial cells, the specialized, tightly packed cells that line the interior walls of the blood vessels inside our lungs. The pathogen latches onto these cells and begins to multiply. Surprisingly, the virus does not directly destroy the lung tissue. It quietly occupies the cells without tearing them apart. The lethal damage actually begins when the human immune system finally detects the foreign invader. The body launches a massive, disproportionate counterattack against the infected tissue. This violent inflammatory response chemically weakens the structural integrity of the blood vessels, causing the tight gaps between the endothelial cells to break open and become leaky. As the vessels lose their seal, blood plasma rapidly drains out of the circulatory system and floods the delicate air spaces of the lungs. This condition is known as Hantavirus Pulmonary Syndrome, or HPS. The clinical deterioration is incredibly fast. Within 24 to 48 hours of the lungs beginning to fill with fluid, the patient progresses from basic flu-like symptoms to severe shortness of breath, plummeting blood pressure, and cardiogenic shock. The pathogen itself isn't what kills the patient. The extreme lethality of hantavirus is the direct result of the human immune system drowning its own lungs in an attempt to clear the infection. Because the physical damage is driven by an immune overreaction rather than direct viral destruction, doctors cannot simply prescribe a targeted antiviral medication to stop it, and there is no broadly available vaccine. A patient's survival depends entirely on rapid transfer to an intensive care unit. Medical teams must physically support the failing organs, often using mechanical ventilators and fluid management, to keep the patient oxygenated while the immune storm eventually subsides. Even with advanced respiratory support, the sheer physical toll of the fluid loss and cardiogenic shock is devastating. Among patients who develop severe respiratory symptoms, the case fatality rate remains exceptionally high, sitting at approximately 38%. Medicine can only support the body. It cannot quickly reverse the syndrome. Therefore, the absolute best medical strategy for surviving hantavirus is ensuring it never enters your respiratory system in the first place. Public health agencies rely on a strict 3-step environmental protocol to break the infection pathway before aerosolization can occur. Seal up entry points, trap up active rodent populations, and clean up the remaining waste. When it comes to that final step, the central rule of hantavirus prevention is absolute. You must never dry sweep or vacuum rodent droppings. Doing so guarantees the virus will become airborne. Instead, the CDC requires wet cleaning. By thoroughly soaking the contaminated area with a 10% bleach solution and letting it sit for 5 minutes, the heavy liquid physically pins the dust particles to the surface so they cannot float away, while the bleach actively destroys the virus's outer envelope. Once the area is soaked and the virus is neutralized, you can safely wipe up the debris using damp paper towels and disposable gloves, sealing the waste in double plastic bags for the trash. Hantavirus is a severe biological threat with a highly deceptive infection cycle, but by simply respecting the physical properties of dust and heavily soaking a contaminated area before touching it, you completely disarm the pathogen before